Good day, all. This talk will examine health and healthcare from the subjectivist perspective. Subjectivism takes a very different approach to this issue than theories like structuralism and Marxism, which generally focus on objective factors like the economy. Subjectivism, instead, tries to get inside people's heads and determine what people think about health and illness. That includes patients, caregivers, and the general public. For subjectivism, everything begins with how people understand their situation, because people act on the basis of that understanding. In other words, everything begins with the meanings that people hold. So, subjectivism asks questions like, what is the meaning of illness? Does an illness mean different things to different people with the same illness? Does it mean different things to the patient than it does to the caregiver? How does being diagnosed with an illness change the patient's self-image? How does it change other people's image of them? In short, subjectivism tells us that illness takes place in a social context, and that society always tries to understand what is happening within itself. So, society imposes meaning on illness. This meaning has changed over time. Early societies, and some people still today, believed that illness was a punishment from a god or gods. It meant that you had offended the spirits in some way, and the route to wellness was to make restitution for your transgressions and to sin no more. This moralistic understanding finds its modern counterpart in those who blame illness on an unhealthy or immoral lifestyle, and for whom the route to wellness also lies in adopting a more disciplined way of life. Modern science, however, understands illness primarily in objective terms. It argues that most illnesses are caused by things in nature over which the individual has no control. Microorganisms like COVID, genetic anomalies in our DNA, even changes in the weather. Wellness can only be attained through objective medical intervention, usually through pharmaceuticals or surgery. As I've said before, subjective definitions have objective consequences. How society subjectively defines illness determines the type of objective treatment which will be given to sick people. Some subjectivists, such as Joseph Schneider and Peter Conrad, have argued that sociologists need to distinguish between disease and illness. For them, disease is the objective pathology of the body, while illness is the subjective meaning of the experience of having a pathology. Different persons can have the same disease but feel like they have different illnesses because they have different understandings of the experience. This in turn has consequences for their treatment. While some people do strictly follow doctor's orders, Schneider and Conrad found that for most people, treatment is established in a negotiation between doctor and patient. The doctor explains his or her position, but the patient then filters that through their own understanding of their situation. For example, as regards medication use. The doctor will normally prescribe the same amount every day. But patients will often take more or less depending on how they're feeling and the social situation they're in. In other words, people interpret the meaning of their illnesses and adjust their medications accordingly. Some people even reject the doctor's definition of their pathology altogether and turn instead to some form of alternative medicine. However, for most people, such measures are a supplement or complement to conventional medicine rather than a replacement. This is why these days it's termed complementary and alternative medicine, or CAM. It's become part of the bargaining process between doctor and patient. Many patients will mostly do as the doctor says, but will also try treatments which the doctor might not approve of. Moreover, objective pathologies have subjective consequences. Getting sick, particularly if it's a serious ailment, changes the way a person thinks about themselves and about their relationship to the outside world. Chronic illnesses like Alzheimer's, Parkinson's, or multiple sclerosis can leave a person in a state of permanent uncertainty as to their own physical and mental capabilities. And even if the objective pathology can be cured, this subjective change will frequently endure. Sometimes this is because treatment has included the use of a prosthetic, which provides a constant reminder of the pathology. Even more often, it's because there is uncertainty and anxiety as to whether the pathology will return. Cancer, heart failure, epilepsy, and many other life-threatening ailments can go into remission for years, only to return suddenly with a vengeance. Survivors of such ailments often feel like they're sitting on a biological time bomb which could go off at any time. For example, my wife, Amanda, is a breast cancer survivor, and she will never not be a breast cancer survivor. The possibility that it could return is always in the back of her mind and always will be. Her self-image has been permanently redefined. The impact of illness on men's self-image has been studied by Caroline Fleuret and others. She argues that debilitating illnesses have a greater impact on the self-image of men than women, because in our culture, men are supposed to be big, strong providers and protectors of women. A sudden inability to do his job or even look after himself can undermine a man's feeling of masculinity, and so undermine his feeling of self-worth, leading to apathy and depression. This is why Fleuret found that many men try to maintain full-time or part-time work, even after their declining health has made this increasingly difficult and often painful. After all, a real man doesn't let sickness or pain stop him from getting the job done and bringing home the bacon, especially if it's Canadian bacon. Julius Roth, who was associated with the Second Chicago School, described his own experience of illness and hospitalization. This introduced an autobiographical turn into medical sociology, which was taken up by phenomenologists like Arthur Frank. these theorists attempted to present both the insider's and the outsider's viewpoint on illness, both patient and social scientist. After all, sociologists get sick too. In the 50s, Mark Swarovski showed that different cultures define pain and illness differently, with the result that individuals experience it differently. He found that in a New York City hospital, patients of Jewish and Italian backgrounds got very emotional and dwelt on their suffering at length, whereas patients of British and Irish background were stoical and silent. Similarly, some conditions, such as obesity, may be considered normal in some cultures, but a medical problem in others. In the 80s, Lynn Payer found that culture also affects the medical professions. Doctors in different countries may give very different diagnoses and treatments for the same symptoms. For example, she found that English doctors are reluctant to prescribe drugs or surgery, while American doctors do so aggressively. Similarly, German doctors are more likely to diagnose heart problems, while French doctors are more likely to diagnose liver problems. In Canada, the traditional culture of Indigenous peoples maintains that health is not just physical, it is also social, psychological, and spiritual. Good health requires attaining a good balance, not just in the body, but also in the mind, the community, and in religious observances. The white man's medicine, which emphasizes surgery and drugs, has often ignored these matters and disrespected Indigenous culture. While the situation is improving, Indigenous people still sometimes have difficulty getting their concerns across to white doctors, and so sometimes have difficulty getting proper treatment. More broadly, studies have found that white doctors tend to devote less time and treatment to ethnic minorities, the poor, and the elderly. It has been argued that, consciously or unconsciously, some doctors define such persons as less socially valuable and so less worth their efforts and resources. Such studies show that subjectivism does not just look at how illness redefines the sick individual's definition of themselves, it also looks at how illness redefines society's definition of the sick individual. Some pathologies are well understood, both by the medical establishment and the general public, but others are not. Those that are less well understood by science are more open to interpretation, and, as I said before, this is often done in moralistic terms. If the person got sick, it's their own fault for doing something wrong. This is what William Ryan first called blaming the victim. If a woman gets raped, it's her own fault for wearing provocative clothing. And if a person gets the flu, it's their own fault because they went outside without a coat on. Blaming the victim sounds ridiculous, but it happens all the time. Our culture tells us that good people are rewarded and bad people are punished. So, if something bad happens to someone, it must mean that they are really bad and so deserve it. This is how many people define others, through the serves you right mentality. When it comes to illness, there are several variations on this approach. The most common is to blame the person's illness on their poor lifestyle and lack of personal care, which ranges from not going to the doctor often enough to engaging in harmful activities like smoking and drinking to excess. Their illness is defined as the result of a personal and even moral failure. Others go further and argue that illness can be the result of a choice, whether conscious or subconscious. When life's obligations become overwhelming, we give ourselves some time off by getting ill. Short-term ailments of this kind range from the child's tummy ache on exam day to adults, quote, taking a mental health day. However, researchers like Lawrence Lashan in the 70s concluded that stress and negative emotional experiences can also lead to much more serious long-term illnesses, including even cancer. Expanding on this idea, some researchers have argued that illness should be seen as a message from the body. If a person has needs which are not being met, they may be expressed through illness. People communicate through body language as well as words. And if they can't express themselves in words, or if those words are ignored, then the body may express those needs in symbolic form as illness. For example, if a person is unhappy but considers it inappropriate to cry and complain all the time, they may instead develop a perpetually runny nose and watering eyes. The problem with this approach is that the more the sick person is blamed for their sickness, the less compassion and even medical care they can expect to receive. Persons who are considered to be responsible for their own illness are stigmatized and socially rejected, which generally makes things worse for them. While this has been done to persons with physical illnesses from colds to AIDS, a greater degree of stigmatization has been applied to persons with mental illnesses. Mental illnesses are generally more poorly understood than physical illnesses, and so are more susceptible to victim blaming. Moreover, physical illnesses usually just make a person go to bed. But mental illnesses can make people engage in unconventional behavior which can be disruptive to society. For this reason, early industrial society dealt with the mentally ill by throwing them out of society and into asylums. In practice, a life sentence in prison. Any so-called treatment which the inmates received there generally did far more harm than good. Irving Goffman, in his well-known book Asylums, published in 1961, argued that asylums do not so much treat inmates as institutionalize them. The principal goal of the staff is simply to maintain order. To do this, they must get the inmates to adopt regular and predictable patterns of behavior. While this seems reasonable, in practice it means the inmates must do as the staff tells them at all times and stick to staff-imposed routines. This introduces habits of obedience, dependency, passivity, and regimentation, which make it difficult for the person to take control of their own life. Goffman also argued that the mentally ill may be stigmatized and shunned, making it more difficult for them to integrate into normal society. Goffman's work on stigma was connected to Howard Becker's labeling theory, which argued that negative labels like crazy or mentally ill could lead to harmful consequences and even persecution of the labeled social group. Only in the late 20th century did our understanding of mental illness improve to where more humane treatment became possible. Since then, organized efforts have been made to reduce or remove the stigma associated with mental illness and to reintegrate the mentally ill into society. However, this is a slow process. Goffman's work was also expanded on by the so-called anti-psychiatry movement of the 60s and 70s, which included theorists like Ivan Illich, Thomas Schacht, and Michel Foucault. They argued that the category of mental illness had been manufactured by the medical establishment with the support of the state as part of the medicalization of social problems. Psychiatrists and other mental health professionals, while supposedly helping their patients, were actually just establishing a new apparatus of power and social control. Moreover, once established, this apparatus just keeps growing. When the first official Manual of Mental Disorders was published in 1952, it listed just over 100 mental disorders. The updated 2013 edition of the manual lists over 300 disorders. These provide over 300 reasons or pretexts for the state to exert control over its citizens. Foucault argued that, with the help of the medical establishment, the state was turning its citizens into bodies which could then be managed by the healthcare system. He said that illness and wellness had been redefined to meet the needs of the powers that be. More broadly, Illich, Foucault, and others spoke out against the growing medicalization of society. In the course of the 20th century, as the prestige, power, and wealth of the medical profession grew, more and more social problems were redefined as medical problems, giving doctors still more prestige, power, and wealth. Psychologist Abraham Maslow once said that if the only tool you have is a hammer, then you tend to see every problem as a nail. Well, doctors tend to see every problem as a medical problem. Any behavior which goes outside of social norms, such as hyperactivity, criminality, alcoholism, and obesity, has been redefined as a medical problem. And modern medicine has two main solutions for medical problems: surgery and drugs. And so the incidence of both has increased steadily through the 20th and 21st centuries. In particular, we have seen the pharmaceuticalization of society. The majority of people in Western society are now regularly taking one or more pharmaceuticals. In addition to the growing number of chronic physical ailments for which a drug regime is now prescribed, It has also been argued that the current Manual of Mental Disorders contains, quote, a disease for everyone and a drug treatment for most of us. Effective psychoactive pharmaceuticals were first developed in the 60s, and their use has grown enormously since then. They were essential to the process of deinstitutionalization. Many people were released from mental institutions because drugs allowed them to control their erratic behavior and function in society. However, there is just one problem with drugs of this type. They're all essentially specialized tranquilizers. They operate by putting the malfunctioning part of the brain to sleep. However, putting part of the brain to sleep means that you're putting part of the person to sleep. Going on these drugs permanently means that you are losing a part of yourself, your originality, your creativity. Going through life half asleep can lead to listlessness, apathy, and indifference. Critics have argued that deinstitutionalization has just replaced metal bars with chemical bars. The patients still remain prisoners of the state. The late 20th and early 21st centuries have seen a partial process of demedicalization. That is to say, there's been a pushback against the growing authority of the medical establishment. This began with the work of intellectuals like Illich and Foucault, but has become a much broader movement. First of all, the cutbacks to healthcare funding by most Western governments in the 70s and 80s prompted a growing turn to alternative medicine. Many people rejected the medical advice of conventional doctors in favor of a variety of alternatives. Even more significant was the coming of the internet. The internet allows anyone to look up information on any topic, including health and medicine. These days, persons receiving a particular diagnosis tend to promptly Google it. They read everything they can, and for better or worse, come to think of themselves as experts on their illness. They may also read the growing number of stories available on the internet concerning the medical mistakes made by doctors, nurses, and hospitals, which undermine their credibility. They may also make contact with online social movements or support groups for their illness and discuss their options. All of this has changed the nature of doctor-patient interaction. While some patients still just follow doctor's orders, most people these days enter into a discussion with the doctor, which may lead to a process of negotiation to determine the course of treatment. As doctors have lost their monopoly on medical knowledge, they have also lost their position of supreme authority in at least some areas of medicine. In addition to the general public becoming more knowledgeable about health and healthcare, doctors have also faced a growing challenge from other authority figures. As the 70s and 80s saw a growing concern about the cost of healthcare, politicians made decisions and introduced healthcare cutbacks over the objections of the medical establishment. In Canada, doctors were largely removed from hospital administration and replaced by private sector management, which prioritized saving money over saving lives. In the US, health insurance was privatized, with the result that the ultimate decisions regarding patient treatment are now made by insurance claim adjusters rather than doctors. In short, the authority of doctors has been undermined by the general public, the state, and the private sector. However, despite this, doctors remain major authority figures in society. Western society respects professionalism above all, and to most people, doctors are the ultimate professionals. The late 20th century also saw a growing concern with the impact of stress on health. It became widely recognized that traumatic life events created a lasting mental trauma which led to poor mental and physical health. Sudden traumatic events like losing a loved one can cause post-traumatic stress disorder, or PTSD, which is essentially a state of shock. But even relatively minor daily hassles can lead to anxiety, unease, frustration, and depression. As modern society has grown more complex and demanding, stressors have multiplied, and stress-related illnesses have mounted. The effects of stress are difficult to establish precisely because stress is subjective. As such, it is understood and experienced differently by different people. A situation which may plunge one person into a deep depression may be shrugged off as unimportant by another person. There's also considerable evidence that when it comes to coping with stress, emotional pain, and difficult circumstances, women internalize while men externalize. In other words, women blame themselves while men blame others. As a result, women are more likely to engage in self-harm and suicide attempts, while men are more likely to engage in aggression and violence. Or to put it another way, when they're in pain, women get depressed, men get drunk, and then get in a fight. Cultural expectations of macho male drunkenness lead to more men dying from violence, traffic accidents, and diseases like cirrhosis of the liver. While the health consequences of stress showed that the mind could have a harmful effect on the body, other researchers explored the flip side of that, looking for ways that the mind could make the body healthier. Such techniques include yoga, meditation, self-hypnosis, and group therapy. In the 80s, David Spiegel conducted a 10-year study of women with breast cancer and found, to his surprise, that those women who went to group therapy and did self-hypnosis lived twice as long as those who did not. This finding has been replicated by subsequent research. The most beneficial effect has been found to come from the social support offered by others in a similar situation. As a result, a variety of illness-based support groups now exist, which meet both live and on the internet. Just knowing that other people care about you may sound all touchy-feely, but it demonstrably improves your health. Knowing that you're not alone in your illness, but you're part of a whole group or community struggling with this problem together, boosts the individual's will to live and strengthens their resolve to overcome the problem. To conclude, overall, subjectivists have examined different aspects of health and subjectivity. First, there is subjective or mental health. For a long time, mental illnesses were thought to be due to biological abnormalities, and indeed some are. But sociology and psychology have increasingly shown that many are due to social stresses and events. The effects of mental trauma often outlast those of physical trauma. Even if trauma does not lead to mental illness, it can still cause the person to redefine their self-image permanently. Many people now think of themselves as survivors of cancer or some other serious illness and remain anxious about its possible return. In its origins, modern medicine focused on physical illnesses with physical treatments. The treatment of mental illness lagged behind that of physical illness. The pharmaceutical revolution, which gave us the first effective drugs for treating physical illnesses like penicillin and insulin, took place in the 1920s. The corresponding revolution in prescription psychoactive drugs did not take place until the 60s, and its results remain more controversial. The late 20th century saw the medical profession gradually accept that a healthy body needs a healthy mind, and greater emphasis has been placed on maintaining and treating mental health. More broadly, there's the whole question of the connection between the mind and the body. Illness of the body can certainly cause illness of the mind, but can the mind cause or cure illnesses of the body? It would seem that, at least to some extent, it can. Moreover, the mind is weak when it is socially isolated, but strong when it is part of a larger social group. Isolated individuals sooner or later generally attempt suicide, while those who feel like they're a part of something larger and more powerful than just themselves are mentally stronger and so physically healthier. Finally, subjectivists have examined the definition of health and illness. Different societies and different individuals have different definitions of these. In the West, the last 2 centuries or so have seen a process of medicalization, which has defined more and more things as medical problems. This has its pros and its cons. On the plus side, it mobilizes society's medical resources to help the individual. But on the downside, it mobilizes society's medical resources to control the individual. Medicalization has also raised the social position of doctors and other healthcare professionals. However, in recent years, this has been challenged by those who would redefine health and illness in alternative, perhaps more spiritual ways. Others still would redefine them as a consequence of lifestyle and even morality. And how society defines illness determines how society treats illness. As I've said before, subjective definitions have objective consequences. And so the line between mind and body is often blurred, particularly when it comes to health. That concludes what I have to say on the subjectivist approach to health and healthcare. transcript of this talk is available if you're interested. Good day.